Hi everyone, welcome back, me again. So today I am going to be popping on my nurse's hat a bit more, and I'm going to be talking about something that would usually be seen as a contraindication immediately. But there is actually some benefit of massage to this, but it does have to be done by a experienced and qualified therapist who has dealt with this issue before. So don't just go to any old therapist, okay? So I'm going to be talking about peripheral artery disease and how massage can help with that, particularly with the leg pains and cramps that are associated with that. So what is peripheral artery disease? Well, it affects probably 1 in 5 people in the UK over the age of 60. And it basically causes plaque to block the coronary arteries, and consequently causes leg pain due to reduced circulation getting through to the limbs. Now, the strange thing is, if people have chest pain, they don't tend to ignore it. They immediately think, my heart, and they tend to go and see a doctor. But strangely, when people get leg pain, they kind of just fob it off and don't really see it as being particularly important. But actually, with peripheral artery disease, it can be just as dangerous as chest pain. So, as we said, plaque builds up in the arteries. This plaque is accumulated calcium and cholesterol, and it blocks not only the arteries in the heart, but also the arteries in the legs. And these blockages can certainly spread to the carotid arteries up towards the head, and also the renal arteries around the kidneys. And people with peripheral artery disease are also 6 to 7 times more likely to suffer with a heart attack or a stroke. So it really is, an important health issue, that you need to kind of really be aware of. Early treatments and certainly a few lifestyle modifications are essential in terms of minimising the risks of that reduced blood flow to the heart and brain. And if untreated, peripheral artery disease can lead to blood clots and also limb ischemia. And, there have been cases even, where amputation has been necessary. So certainly treatment is really important, but the problem is that quite often, peripheral artery disease is asymptomatic. So a lot of people, not even diagnosed, they're not even aware that they have it. Now, while massage can relieve the pain and discomfort of peripheral artery disease, and it can do that by restoring the circulation. As I said at the beginning of this video, only an experienced and qualified therapist in this area should be treating this, and even then it should only be happening with the consent of a doctor. And this is because of that increased risk of a deep vein thrombosis, because the last thing you want to do is, go see a therapist who doesn't know what they're doing, doesn't understand the, physiology behind the condition, and does completely the wrong techniques. And then you throw off a blood clot and hey ho, you're in hospital having a stroke. Not really, the outcome you want from a massage. So yeah, So seeing a registered, qualified, experienced therapist is really important. So, who is at risk of developing peripheral artery disease? Well, this is where I'm going to say all of those sort of standard lifestyle things that people hate hearing from doctors. Smoking. Smokers are definitely at risk because, as we know, smoking can damage the blood vessels and restrict circulation. Those of you that are aged 50 or over are certainly at higher risk. Anyone who's overweight or who has high blood pressure or high cholesterol or triglyceride levels. Also, diabetics tends to be at risk. And this is probably because a lot of these other factors can be linked in with diabetes, maybe being overweight or, the blood pressure. So that is, but, a lot of these are things also that you can, work on with changes to your lifestyle. So as we've said, smokers and diabetics are at increased risk of tissue death in the legs. And this again is due to that reduced circulation. So when we talked about limb ischemia, that's certainly going to be a factor with those who are diabetic or smokers. Also, if you have high cholesterol, or if you're diabetic, just make sure that you are compliant with taking any medications, for example, statins, which are there to help prevent blockages and these symptoms of peripheral artery disease. So that's really important that you do take any medication. Now, so in terms of signs and symptoms, we said, peripheral artery disease, a lot of the time it tends to be asymptomatic. People often don't realise that they even have it. And around 50% of people have no symptoms or, extremely mild symptoms that could probably just be passed off as, oh, I've done a lot of walking today, so my legs are a bit tired, that sort of thing. But probably one of the biggest symptoms is something called intermittent claudication. So, intermittent claudication is basically limb muscle pain or cramping that worsens with activity but disappears when you are resting. And it happens particularly in the calf. It can be mild or actually quite debilitating to the point of actually preventing physical activity. And so if we look at the arteries in the leg, so you've got the aorta, which leads down into the iliac artery at the front of the groin, into the femoral artery down the front of the thigh, the popliteal artery at the knee, then going down to the tibial artery. Now, in terms of this cramping and pain, it can start around the buttocks, hips, thighs. It can go down the thigh and into the calf, right down even into the foot. And basically this pain and cramping is an indicator of narrowed arteries. So you can see here, blood normally would flow through these arteries and other blood vessels. But with peripheral artery disease, what happens? We have this accumulated calcium and cholesterol that builds up in those blood vessels, forming this plaque. Consequently, the blood flow is reduced and may even be completely stopped. So other symptoms that may be experienced are inability to walk either as far or as fast as you normally would. And that will be because your legs are very tired, very achy, which again, due to the reduced blood flow. You may even get, numbness or weakness in the legs, possibly cold feet and legs, maybe with a change in the colour of the skin. And certainly with diabetics, it's a concern. You may have sores or ulcers on the legs or feet that just don't seem to heal no matter what you do. And again, it's due to the poor circulation. You may also notice loss of hair on the legs and feet, and maybe changes in the appearances of the nails. And if you have a more severe case of peripheral artery disease, then you may even suffer from something called ischemic rest pain. And this is basically where the peripheral artery disease progresses, or maybe is left untreated. Pain can then become an issue while resting, which is usually when the pain disappears. And this can then cause, difficulty with sleeping. But, sometimes people find that just, if this is the case, hanging the legs over the side of the bed, or maybe just getting up to have a little bit of a walk around, may just offer a little bit of relief from that pain. So in terms of treatment, how do we treat peripheral artery disease? Well, certainly there are those preventive lifestyle changes, for example, giving up smoking, but if those things and if medication, don't improve the symptoms, then, you may need to see possibly a vascular surgeon for something like an angioplasty, possibly even insertion of a stent just to kind of open up those blood vessels and allow, the circulation to sort of improve. But certainly, one of the things that I am going to talk about a little bit later is obviously how massage can help. So that may be something that you can consider before it gets to that point of having to see a surgeon. Now, first though, I'm going to talk about those, preventive measures, before you even have any problems, or, those lifestyle changes that you can make if you've maybe just been diagnosed. So certainly, walking and exercise are essential in easing the symptoms and the pain by improving the circulation. And, yes, it is difficult when, you're getting pain on walking, but, this will help to improve the circulation. So, even if you just progress slowly, do what you can, that's going to help. The accumulated plaque in the arteries that we've talked about, basically, as we know, it restricts the blood flow to the arms, legs, head, and also to the organs. So, walking, and, even if you do a bit of walking, bit of rest, bit of walking, bit of rest, that will help improve that blood flow. But do listen to your body. If you're in pain, then do stop and then just start again when the pain subsides. Progress slowly, and also do remember, just have a bit of a stretch, particularly those calf stretches, before and after you go for a walk. The right exercise is so important, and it's recommended that you have at least 30 minutes of exercise several times a week. Now, if you're finding that you're getting bored with walking, certainly other, low impact exercises, so things like swimming, cycling, yoga are great for people with peripheral artery disease. Exercise will, as we said, it will certainly help to reduce those symptoms. It will also help to lower your blood pressure, which high blood pressure is often a contributing factor, and also your cholesterol levels. And also the other thing exercise, of course, will do is to basically condition your muscles to use oxygen more efficiently. And that's important because if you've got restricted blood flow, to the muscles, then, it's the blood that carries the oxygen around to your muscles and helps prevent those muscles from getting tired and being prone to injury. So if you are conditioning the muscles, to use the oxygen more efficiently, then it means it will, the muscles will be making better use of, that reduced sort of oxygen intake through the reduced blood flow. Another thing you can do is really have a look at your foot care. Because pain and numbness in the legs is common with peripheral artery disease due to the restricted blood flow. And this is going to be more apparent, during exercise when the muscles are really relying on that circulation, as we've just said, to bring oxygen and nutrients into the muscles. If circulation is poor, there is a higher risk of infection. And again, particularly in diabetics, foot care is really important. And if you end up with an infection, this can cause further problems and make it also difficult to stick to an exercise plan, because if your feet have got sores on that aren't healing, it's going to be probably quite painful walking around on them. So, make sure that you are wearing comfortable, well-fitting, supportive shoes. Check your feet daily for any sort of sores, cracks, corns, calluses, and if necessary, see a podiatrist. Wash your feet daily in warm water, not hot, because if you're getting any kind of issues with numbness, you don't want to be risking burns, with hot water. Don't soak your feet for too long, because actually that can make the skin dry out. And also, dry your feet thoroughly, because we don't want to risk, any sort of fungal infections or anything like that. Throughout the day, you can, just wiggle your toes regularly. It just helps keep the blood flowing, right down into the feet. Avoid walking barefoot. And also, if you do get any kind of maybe fungal infection or sores, treat them quickly. Also, keep warm. When you're cold, your blood vessels will constrict to maintain body heat. So, that's not going to help, having constricted blood vessels when you've already got a reduced blood flow. So do keep yourself warm. Keep those, it just helps keep those blood vessels nice and dilated. Also, we've mentioned about smoking. Quit smoking. I know it's easy to say, but, as we've said, smoking constricts and damages the blood vessels, making it harder for your arteries to carry blood around your body to the muscles, to the organs where they're really needed. The other thing that people might not think about is avoid some cold medications. If you have got a cold and you want like your Beecham's hot lemon or whatever it may be, just check the labels, because some contain a substance called pseudoephedrine. Now, this is found in some of these cold medications, but it actually can constrict the blood vessels. And again, as we just said, if the blood vessels are constricted, this is going to worsen your symptoms. So just check the labels and make sure that that's not in whatever medication you get. Another obvious one is diet, eating well, if you're overweight, trying to just lose some weight, increase your consumption of fruits, vegetables, whole grains, fresh foods, reduce intake of salt, sugar, alcohol, and saturated fats. Certainly the Mediterranean diet, can really help reduce blood pressure and cholesterol levels, which of course are both contributing factors to peripheral artery disease. And also eating foods that are rich in omega-3 fatty acids. Oily fish is a classic example, can also really improve blood vessel health. So, in terms of massage for peripheral artery disease, why is it so good? Well, it's one way to relieve pain due to peripheral artery disease, because as we know, it stimulates the circulatory system, helps improve blood flow, improve transportation, therefore, of oxygen and nutrients to the muscles. It helps avoid cramping and spasms in the muscles. But it must be done using specific techniques with doctor's consent. Another benefit, of course, is that, and it's something that I've recently posted about, is with regards to, we know that massage also can help, by its effect on the nervous system, help dilate those blood vessels and therefore reduce blood pressure. And also high blood pressure, as we've said, is another contributing factor to peripheral artery disease. Now, if the massage is not done by someone who is adequately qualified and experienced in this area, the consequences can be fatal. And as we mentioned, I think at the beginning of this video, for example, by releasing a blood clot, and nobody wants that to happen. So when used alongside these lifestyle modifications and medications, massage can really help to slow down the progression of peripheral artery disease. Massage is not a standalone treatment for this, so you do need to combine it with conventional, medical treatment. Doctor's consent is particularly important. It's important anyway, but particularly important if the client also has risk factors for deep vein thrombosis. In terms of the treatment itself, the duration of the massage on the legs should be, it should be done frequently, but short sessions. And by short sessions, I mean literally like 2 minutes per leg. This has actually been shown to be more effective than longer sessions, and also just, avoids sort of the risk of overdoing it, and as we said, sort of throwing off a blood clot. The methods that would be used on the legs will be very different to what would be used in a standard massage treatment. So, we'd be looking at using something called butterfly to potement, which is a very gentle technique to loosen the muscles that have hardened due to these blockages in the arteries. And it uses like a rhythmic tapping, similar to, so it sort of be like that sort of motion, similar to butterfly movements, and it will be done along the calf from the ankle to behind the knee. And it will just manipulate the soft tissue of the body to help improve the blood flow and also relieve any muscle spasms or pain. This can then be followed up by something called fluffing. Now, some of you out there might have a different meaning for that word. That's not what we're talking about here. So, fluffing technique basically combines effleurage and petrissage, which are two of the other massage techniques. So you apply a gentle effleurage stroke towards the heart, and that's the one that will sort of create this vacuum in the arteries to help pump the blood through. But you'll combine it with petrissage, so you'll give a short sort of squeeze every inch or so. So it'll sort of be a combined stroke with a squeeze. This, as I've said, can be done after butterfly deportment, with the client, laying on their front. The fluffing must be done with the muscle in a relaxed position to benefit from improved circulation, and it shouldn't be used on any clients who have that ischemic rest pain that we talked about, where the peripheral artery disease is either left untreated or is more severe. But generally, fluffing is beneficial because it doesn't tear or bruise the calf muscles, which of course we want to avoid, because again, we don't want to risk throwing off a clot. Now, exercises for peripheral artery disease. We talked briefly about the importance of exercise. It's certainly the first line treatment for peripheral artery disease, walking being the obvious one. It can also help to revascularize those clients that have that claudication, that have that limb pain and cramping. And it can also obviously relieve cardiovascular stress, helping to hopefully improve blood pressure levels as well, which is also a contributing factor. And maybe if you're overweight, it will just help you lose a bit of weight that will also improve, your overall health and, symptoms. Weight-bearing exercise also, can improve symptoms. So, as we've said, walking is the best exercise, at least, 3 times a week for 30 to 60 minutes. You can include a strength and balance exercise. You can get like these little strap-on weight bands. You could even pop those around your ankles just to kind of add a bit of strength training. Nothing too over the top, but also things, you can go to the gym, go on the treadmill, bowling and weightlifting, they are all beneficial. Stair stepping is another one. It's a low impact, weight bearing cardiovascular activity. Calf raises, so in terms of doing stretching, and to strengthen those calf muscles, calf raises are great for improving blood flow. You can also see, if you look at my previous post on the calf muscles and calf injuries, I do also give some calf stretches at the end of that post, so take a look at those as well. Cycling, another low impact exercise, and research shows significantly improved quality of life in peripheral artery disease clients, and also improved hip movements with cycling. And again, also to improve mobility, yoga is great. A good overall body workout will help to reduce that cramping by increasing oxygenation and blood flow to the muscles, and also will help to reduce the formation of that plaque in the arteries. So a few suggestions for you there, but as I say, it is a case really of combining massage, exercise, and these lifestyle factors with, conventional medical treatment, probably, medication, maybe to reduce cholesterol, or if you're diabetic or high blood pressure. And it is important, to keep taking that medication as well. So that's really all from me on this subject. Do feel free to comment down below or message me with any questions through my Facebook or Instagram. Feel free to subscribe to my channel. There's lots of other posts, both in terms of sort of muscles and sports injuries, but also other medical issues as well. There's also one on hypertension and how massage can help, and I also did one on how massage may be able to just help you if you are on a weight loss journey. So do take a look at those. But that for now is it from me. So take care, and I will see you later. Bye.